Just Hi, my name is Connie. I'm going to do a speech on how to complete a nursing assessment. The first thing that you want to do is get a patient and get your form. You're going to find out your patient's first, last, and middle name and why they're being admitted to you. You also then need to know their age and their sex. The next thing you're going to do is get a patient history. You're going to find out any medical problems that they've already had, any family issues that run through their family, any social habits that they may have, if they drink, smoke, do illicit drugs, or anything of that nature. You also then want to find out their primary contact, who's responsible for them, whether it's their spouse, their parent, their next of kin. And then you want to have a phone number to be able to reach that person. From there, you're going to do a system assessment. You will check your patient for their vital signs by checking their pulse. You'll take a stethoscope and listen to their lungs. You're going to check their abdomen with your stethoscope for bowel sounds, and also to see if there is any tenderness noted when you palpitate it. You're then going to check their range of motion to make sure that all of their limbs move the way that they should without causing any pain. So you want to move the arms up and down, side to side, and then have them squeeze your hands. You also want to check their legs to make sure that their legs move okay and that there's no issues there. If they're able to stand up, you'll want to have them stand up and bend over to see if it causes any pain in the back or any other region. Go ahead and sit down. The importance in doing this is because sometimes a patient may be admitted to you for a cardiac issue and you may not be aware of other issues that they may have. You'll also do a skin assessment where you take your patient and examine every piece of their skin. You would want to do that in private because you need to take off all of their clothes and look at all of their skin to check for any bruises, rashes, sores, cuts, any other marks that they may have. You'll want to make sure that if you do see any red areas like this, that you have a reason for it, and then also mark it down on the paper. That also goes for any surgical scars or any accidental scars that they may have accumulated in their life. The importance of that is that if you were to find a reddened area or an open area on a patient when you admit them, if you mark it down on your admission assessment on this back portion where the bodies are located, you would then know that that was already there on admission. So 3 weeks from now, if that area gets worse or somebody just notices it, it was already there. If weeks go by without the area being noticed and then it's found, as a facility you can then be cited for being an acquired wound versus a wound that the patient was admitted with. You also want to find out if your patient has any allergies to any medications, to food, to laundry detergent, to any other products that they may be allergic to. This is a 4-page assessment, so you're going to start on the front where you're putting in their basic information, their names, their vital signs, allergies, etc. Going through the inside, it is going to show you an area. This top portion here is where you're going to put any medications that they are on, how often they take them, and what the dose is. You also want to include over-the-counter medications such as vitamins, herbs, and supplements. You want to check their level of consciousness to see, my patient here is alert. And to check his cognition, I'm going to ask him a couple of questions. Jacob, can you tell me your name?
Jacob.
What day is today?
Wednesday.
Do you know where you are? Okay, my patient does not know what day it is or where he's located, so he would only be considered oriented to himself. So that would be marked on the form as A&O by 1. I would then also see if he has any behavioral factors. If he is verbally or physically abusive towards others, if he's socially inappropriate or resistive to care, or if he's likely to wander around. I would also check his hearing, speech, and vision. Some of this can be done without directly asking. You can note a patient's hearing just by having a conversation or doing the assessment with them. Their vision, you may ask them, can you see this over there? Can you read that to check their acuity? For neurological, you're going to find out if he has any dizziness, any problems walking, if he's had any recent headaches that are abnormal. Again, you'll check his respirations, his heart sounds, to make sure there's no abnormalities there. You're also going to check his oral cavity. Open your mouth. This is actually best done with a flashlight by checking not only his teeth, but his tongue to make sure his mucous membranes are moist. Make sure that his teeth are in good repair. If there's any cavities or broken teeth noted, you would want to note that in this section as well. For nutrition, that you typically get more from the hospital record based on if they have any swallowing or chewing difficulties, any gastrointestinal issues, if they're having any nausea, vomiting, or diarrhea. If they have any issues with urine or bowel movements, is he able to know when he has to go to the bathroom, or would he be incontinent? You also want to find out his physical function. How does he do everything? How does he go to the bathroom? How does he turn over in bed? How does he walk? How does he eat? Then you also want to do a portion that's called a fall screen. And this screen is to determine how much of a risk he is for falling. Similarly, on the back, there is a scale called a Braden scale, and that scale is used to determine the risk of somebody getting a pressure ulcer. And that is based on factors in regards to their sensory perception, moisture, activity level, mobility, nutrition, friction, and shearing. And in that, from this assessment, you're going to be able to determine most of your patient's needs. How your patient needs to eat, medications that they may need, how they need to go to the bathroom, so that you're not only looking at the cardiac issue that he was admitted with, but you're looking at the patient as a whole. And sometimes along the way, you may find other issues that need to be addressed with the physician as well. The Ohio Board of Nursing dictates how an admission assessment must be done for a long-term care facility or other group home, any of those type of facilities where a patient may come to long-term. And according to the Ohio Board of Nursing, you only have 24 hours to complete the entire assessment. Some of the items may take longer than others. You may be able to do the initial skin assessment and system assessment right when the patient comes in the door. However, finding how they walk or how they eat may take you a period of a few hours to even a day to monitor them to see exactly how they do what it is that they do. And then you would also make referrals to therapy if needed, so that they may address those issues and discuss it with the physician as well to see if there's any additional tests or medications that they may need. And that is how you do a nursing assessment.